In this video, we hope that you will learn more about the use of mediation in cases where there are disputes about the provision of health and care to adults and children. As part of our study which informs this video, people who had taken part in mediations shared their experiences with us. This video draws on those experiences to help you better understand mediation's possible role in health and care disputes. These are usually disagreements between a patient or the patient's family members and healthcare professionals about the medical treatment or care the patient should receive. For example, in a dispute concerning critically unwell adults or children, where withdrawing life-sustaining treatment is proposed, the family members might want more time with their loved one or to try other treatments, whereas the healthcare professionals may think that any future treatment is futile. Mediation is a form of non-court-based resolution that involves an independent third party, a mediator, working with individuals in a dispute to help them reach agreements about ways forward. Mediation is a voluntary process that is meant to be flexible, confidential, and party-led. Typically, before mediation occurs, the mediator will have pre-mediation meetings with the parties. These pre-meetings can be helpful for the parties, as one of the mediators we spoke to explained. The pre-meetings give the mediator a chance to explain to the parties how mediation could help. Sometimes people need coaching on how best to participate in the mediation, and that can include learning how to undertake collaborative dialogue. Mediation might not be suitable in some cases or for some parties in disagreement. The pre-mediation discussions help the mediator and the parties identify if mediation would be suitable in their case. At the start of the mediation, the parties will introduce themselves and the mediator will set out ground rules and discuss confidentiality, timings for the day, and the agenda which the parties will have fed into to set up the priorities for discussion. We are now going to show you a fictional case study based on the research we have conducted. It is a dispute regarding an infant, Olivia, who was born with a rare mitochondrial disorder. There is no cure for Olivia's disorder, and her condition has steadily deteriorated over several months. It has now reached the point where her vital organs have suffered irreparable damage, and she is dependent on round-the-clock support and treatment to survive. Dr. Eliza Reed, who is one of the treating clinicians, believes it would be in Olivia's best interests to withdraw life-sustaining treatment. Olivia's parents, Carrie and Richard Watson, do not agree to the withdrawal of treatment, as they feel their child has not been given a chance to survive. The dispute has reached the point where the relationship has broken down, and the next stage is likely to be court proceedings if mediation cannot help to resolve matters.
Good morning, everyone. Thank you for agreeing to be here today. I know it's taken a while to get here, but the fact that you've all agreed to meet is a really, really positive step. So as we've discussed in our pre-meetings, today is all about the next steps and how we take them for Olivia and her future care and treatment. So it's about finding a way forward together. And this is a space for you all to voice your thoughts and your feelings and to find out what it is that you would like for Olivia. In a moment, I'm going to run through what I'd like to suggest as a plan for today and to make sure that you feel it's acceptable. But before I do that, I wanted to take the chance to welcome you all and to see if you have any questions before we begin.
Yeah, Charlotte, thank you. To be perfectly honest, Richard and I almost didn't agree to this mediation. It's taken a lot for us to be here today. We thought you were just someone else coming from their trust to convince us to go with their way. But thank you for coming, for your time, and for the time you took to come to see Olivia at the hospital. It really turned us around. The whole time we've been at the hospital, we've not been communicated properly, and people are not talking to us properly, and they're not listening to us. We felt like no one cared about us and we felt so alone. So thank you for coming and listening to us. It means a lot at this difficult time.
Well, thank you, Carrie, and it's my absolute pleasure to meet you both. And of course, I was so glad that I got a chance to meet Olivia in the hospital too. And I also want to thank you for bringing in a photograph of her. I think it's just so important to have this picture here with us today. So I'm going to put it up on the flip chart. It's so important to remind ourselves of those that aren't able to be in the mediation, because it will help us to think about who we're here to talk about and agree best next steps for today. So great. Thank you. Do you know, I just want to remind you that I'm not here to make judgment, I'm not here to take sides, and I'm certainly not here to tell you what to do. So today is about you finding the best way to move forward together and deciding what is best for Olivia's future care. So, you know, while it would be good to come away from today with some kind of agreement, it really isn't about one party trying to convince the other of their point of view. And this is not an adversarial process, it's not a battle. We're here simply to look at Olivia, her life, and what the future looks like for her. Eliza, now that you have heard what Carrie's had to say, how are you feeling about this?
Honestly, I'm so sorry. I really didn't think my words had that impact on you, and to hear how they made you feel. If we gave you the impression that we don't care about Olivia, then that was wrong. I know sometimes we don't always communicate as well as we could. You know, as professionals, we try our best, but we don't always get it right.
You just made us feel as if we are deliberately trying to make Olivia suffer. We are her parents, and we don't feel like she's been given a fighting chance. And I know you feel like there is nothing more that can be done. I understand that, but we won't give up on Olivia.
Yeah, Carrie, Richard, you've both said that you won't give up on Olivia and that you both feel she hasn't been given a fighting chance. Would you like the chance to explain a little bit more about that?
You already said that nothing more can be done, and I'm not a doctor, but I don't really know what else to try.
Carrie, we absolutely don't want you and Richard to feel that we're giving up on Olivia or that you're giving up on Olivia. And I want you to know we're not giving up on her either. We all wish we could do more, but sadly MDDS, the genetic condition that Olivia has, is very difficult to treat. It's causing a slow degeneration of her body to the point that she can't stay alive by herself. Her vital organs have been affected to an irreparable extent, and at the moment there is no known treatment to stop the degeneration except for experimental therapies, which have not been proven to work for Olivia's specific condition. I really can't imagine how hard it must be for you both to hear this, but we think we've reached the point where we're moving to palliative care will be the next step for Olivia.
Carrie, Richard, is this the first time that you've heard the Trust mention palliative care? Would you like to ask anything else about this?
We just find it hard to take in. Palliative care is just letting someone die.
Palliative care is not about letting someone die. It's all about quality of life for patients and giving them dignity in their final days. It's a flexible, personalized approach, as we don't just focus on the physical and mental well-being and clinical technicalities. We focus on the psychological, emotional, and spiritual well-being of the patient, and we welcome guidance from the family pertaining to their care.
I can't even think of such a thing as end-of-life care right now. She hasn't left the hospital. None of our family abroad have been able to see her since she's been born. It's been nothing but medical tests and treatments. She hasn't been baptized even yet. I'm sorry, but I can't let her go like this.
You know, Carrie, we could have a prayer service for her here in the hospital, and you can invite members of your church. We can even have her baptized here in the hospital, can't we?
Of course, this is all something that can be arranged. Some of the family members of the patients in the past have organized prayer services in the hospital with members of their church towards the end of their child's life.
Does that mean I can also bring people in to see her?
Yes, of course, we'll do our best to keep Olivia stable so that you can bring your family and friends around to spend time with her and see her.
Thank you, we appreciate that.
Carrie, now I'm wondering, having heard all of this, how do you feel about it now?
I mean, I'm not agreeing to anything yet, but I do feel a lot better after hearing all of that. I have to admit, I didn't realize we could do those things like have prayers at the hospital and have Olivia baptized there. I'm not saying I'll go with palliative care.
But I think we're willing to hear you more on that.
You've made some really good progress today, and I want to thank you all for taking the time to be here today and for being able to agree some next steps for Olivia's care. So, not all the issues that have been raised today have been resolved. However, I would like to run through what we have agreed to make sure that nothing has been left out or been misunderstood. So, you have agreed on an advanced care plan for Olivia, and this is focused on supporting her and your family before ventilation is withdrawn. So, over the next 4 weeks, Olivia will remain fully ventilated in PICU. And during that time, Carrie, you have asked that you and your family will be able to have time to come in and visit Olivia. Okay? You'd also really like to come in with your church group into the hospital and have prayer sessions for Olivia. And you'd like this in the days before and in the morning of the withdrawal. Is that right?
Yeah.
Yeah.
Would you like to say anything about that, Richard?
No.
I think this would really make the process better for us. I think we're really going to rely on that support.
Yeah, of course. Thank you for confirming. And you've said how important it is for you both. Eliza, now having heard this, you also, as you and your team, have agreed that you're going to stick to the plan for Olivia's care as closely as possible. And where you may not be able to stick to the plan and follow it fully is where it may compromise Olivia's care and what might be in her best interests. So for that reason, it's important to you that you and the trust will be able to consider issuing proceedings in the court. And you agree that the trust will aim to let Carrie and Richard know in advance to avoid a situation of surprise or shock. And that you're both in agreement with that, is that right?
Yes.
Okay. So, thank you. What I'm going to do is write up these notes into a mediation agreement, and I'm going to email it to you all so that you'll all be able to see it and seek further legal advice if required. And please feel free to come back to me with any questions or any further comments that you may have, and then we can also arrange a further mediation session if needed. Please just...
This snapshot of mediation highlights some of the findings from our research, which showed that mediation can be a participatory process. The focus of mediation is not for the parties to be told what to do, but rather to give each individual the chance to voice their feelings, wants, needs and expectations, and decide on next steps. Mediation can help to encourage a deeper understanding between the parties. A well-designed process in a safe, confidential space with an independent facilitator can help parties feel more comfortable and better able to articulate their feelings. Because mediation relies on parties collaborating and identifying solutions themselves, both the process and the outcomes can be flexible. Parties are able to tailor the process to suit their specific needs, and they are able to come up with more creative solutions, which may not necessarily be legal outcomes, but are outcomes that they are both able to accept. Despite the benefits of mediation noted here, we can see that, in the beginning, the parents appeared closed to mediation. Initially, they were cynical about the mediator, thinking that she was just another person from the hospital. This highlights the importance of the mediator being perceived as independent of the healthcare professionals. While this cynicism and closeness does not disappear completely, you can see the family start to feel more open-minded and more willing to listen through a well-designed process. Our research found that some participants can be closed to mediation and closed to resolution, and some are cynical about the mediation process. Any individual who takes part in mediation must be given the time and space to voluntarily decide to engage with it. Some may have had poor experiences engaging with legal or mediation processes in the past, and may need more information about what mediation is and how it can help, although mediation won't be right for everyone. This second fictional case study, based on our research, concerns a health and care dispute about an adult male, Andrew, who requires day-to-day assistance with his health and care needs. Andrew resides in a supported living arrangement, and while he has a team of carers, his father is very involved in his care and visits him often. Unfortunately, tension has arisen between Andrew's father, David, and the care team over the last few months. David is concerned about aspects of Andrew's care, such as his diet and clothing, and there is a sense of distrust on his part, as he does not always agree with the way Andrew's care needs are met. The healthcare professionals are frustrated with the family members as they feel they have unrealistic expectations of Andrew's progress. Proceedings were issued in the Court of Protection, during which these issues were raised before the judge, who recommended that the parties attempt mediation.
Now we've all done our introductions, I'd like to remind you that we're here today to discuss the outcomes and actions that you can all work towards achieving for Andrew today. So when I met with you each before, you identified key issues for today that you would like to discuss, and they included Andrew's clothing, Andrew's diet, and family visits. We'll have plenty of time to discuss these and any other issues that may arise. But the aim today really is about you having a discussion and working in collaboration with each other. I'm here to facilitate, but the aim is for you to collaborate. I'm a great fan of feeling words, so I thought we could begin with finding out how you've both been feeling over the last 2 months. David, how about you start us off?
Yeah, well, I'm feeling quite hopeful. The last few months have been difficult. I admit I'm not the easiest person to deal with. I can come across as a bit strong sometimes, but that's because I care about my son. I want him to have the best possible life he can.
Okay, that's good to hear. Mike, how about you?
Yeah, I mean, I'm feeling pretty open-minded. As David said, we just want the best for Andrew. And if this mediation allows us to sort out our differences and come to some agreement so we can work better together, then I'm all for it.
Great. Well, I'm really happy to hear that you're both approaching this with a positive mindset. And that is a really good thing for Andrew. And it's really positive for us and to keep in mind, this is not an adversarial thing, it's not a battle. We are working as a team here today, and together we are Team Andrew. So now you've both said about how you're feeling hopeful, I'd like us to focus on thinking about what has gone well for you both in the last few months, And we're going to take a bit of time to write it on post-it notes, which I've got here, and take some time. What you're going to do is just write out everything that you feel has been going well, and we'll then stick them up on the chart.
Yeah. So there's a lot of research on how consistency is important for patients with autism and high sensory needs like Andrew. At the moment, change is very distressing for Andrew. As soon as there's something he's not familiar with, you can see that it makes him uneasy. It doesn't matter if it's a new activity, a new person, or a change in his routine.
What, you're saying I stress my son out? Is that what you're saying?
David, this stuff is hard. Sometimes in mediation we hear things that upset us. If we could just let Mike finish, and then you can respond.
All right.
No, I don't mean that. It's just, basically what we would like is for family visits to be scheduled for just once a day, ideally at the same time each day, at the evenings, even at weekends. It's because we like to plan a few activities during the day for Andrew, and we like to do those consistently in a routine. It's not so easy for care staff just to move things around as it would be for you and I. Andrew's just not at that level of flexibility yet. He likes routine, he likes predictability. It eases him.
Okay, David, how do you feel about this?
I know all this. I know my son. I hear what you're saying about routine and consistency and all that, but at the end of the day, I am Andrew's father. I like to spend time with him, especially at the weekends. During the week, I don't have so much time because of work, but at the weekends, I have more time. So obviously, I'd like to come in earlier and spend more time with him. I'll bring in some movies or do something else, and he enjoys those.
No, you're right. Andrew does really enjoy your visits at the weekends when you come with his siblings and stay longer. It's clear that Andrew looks forward to your visits. And as much as a consistent routine benefits Andrew, this time with his family benefits him too. Maybe we can come to some arrangement. It doesn't have to be as rigid as I said earlier.
Okay, so you've both said what you'd prefer in terms of visits, but you've also said what else might be possible. So I'm going to go up to the flip chart and we'll get a chance for you to put post-its up now about the visits and what's going well, but also any suggestions you have on how the visits could look in the future. Now it seems to me that we have some similarities here. Look, you've both put sharing the family schedule under suggestions for Andrew. And under here, under working well, you've both agreed that family visits are a really positive thing and that you're both on the same page in terms of the value of family visits. So what I'm going to do is I'm going to put what's working well and everything we agree on here in one place. And that means then we'll work through the remaining issues one by one. So you have made some really positive progress today. Lots of creative solutions and outcomes for Andrew. And you've reached an agreement on Andrew's diet and on his clothing, and a tentative agreement on family visits. I know it's not an easy fix, but it's important that we reassure David that nobody is trying to restrict his visits. So you're going to trial that schedule that we've created today. And Mike, I'd really like you to take this back to your team and ensure that this is suitable and in line with Andrew's care plan. And I'm going to now write up all the outcomes and agreed actions, and I will email it to all of you and to legal representatives via email. And if any of you do have any further questions or you want to iron out any further details, do get in touch. We can arrange another session. But I think the key thing is that you continue this open conversation between the two of you. You know, you have really made positive progress for Andrew. I know it feels like our brain power's been squeezed today, but you have made good progress.
This case study has shown how parties can collaborate at mediation. The onus is on the parties to work together to come up with ways forward, guided by the mediator. Note how the mediator gets the parties to collaborate by showing them they have some middle ground and giving them starting points to work on. The mood becomes less adversarial between the parties. From being defensive at the start and having heated discussions, the parties begin to work together more peacefully, linked to the collaboration that the mediator encourages. The role of the mediator is essential in creating a space where participants can feel better about the dispute. In this case study, the mediator often checks in with each party to see how they are feeling throughout, and when discussions become heated, the mediator works to bring the emotion in the room down. The benefits of mediation can work as a form of emotional catharsis for participants. In our research, we have heard that at the conclusion of mediation, participants often feel a sense of relief from being able to express their feelings and sometimes get closure. On behalf of the research team, we would like to thank you for taking the time to watch this video and showing an interest in the role of mediation in health and care disputes. If you would like to find out more about the findings of our research study, you can contact a member of the research team.